and it should be good. So we'll be talking a little bit about pain, some self-management tips, and as well about arthritis and osteoarthritis. So just to begin with a couple of definitions. So pain is an unpleasant sensory and emotional experience that's associated with actual or potential tissue damage with sensory, emotional, cognitive, and social components. So this means that it's related to actual or potential tissue damage, which I'll elaborate on a little bit after. So pain can also occur as a result of actual tissue injury due to wound, disease process, or invasive procedure. So it can also act as a survival mechanism in which pain can act as a warning sign. So for example, if you were to touch a hot burner, one reflex that we know is the withdrawal reflex. So you're gonna remove your hands from that burner, and there's also gonna be another signal that will be sent up to your brain, and that will trigger it and say, ouch, that's painful. So next, pain can be dependent on the context, interaction of subjective perception, some learned responses, and observable expressions. So I'm just gonna give an example here. So with somebody walking down the street, and if they were to roll their ankle, for example, in case number 2, if somebody were to roll their ankle while trying to run away from a bear. So I'm asking you a question. In which situation do you think the individual will experience more pain? So I'll let you think about that for a little second. And so it's actually in case number 1. So in case number 1, when they're just walking down the street and they roll their ankle, there's nothing in harm's way. So the focus will be more guided towards that ankle. However, in situation number 2, when the bear is there, which is more kind of that survival mechanism, the individual will be more focused on running away. So they might disregard the pain from their ankle. So what is pain? Pain is complex. Pain is variable. Pain is confusing, or all of the above. So in this situation, it's all of the above. Pain is being researched constantly. For a lot of people, it can be confusing. It could change a lot, and it is very complex. So that is normal to think like that. And how do you feel when you are in pain? So you can be frustrated, angry, feeling of being secluded or lonely, sense of not being yourself. So these are common as well amongst many individuals that experience pain, but hopefully after this talk, we can maybe change some of these feelings. So pain and tissue damage. Like I mentioned before, pain does not always equal tissue damage. Pain can sometimes limit and change movement, which may happen, but one example where pain does not equal tissue damage, there have been many studies that have looked at disc bulging or herniation. So within your spine, you have some discs, and in certain occasions, you may present with disc degeneration or kind of bulges, but those can be painful and sometimes maybe not painful. So, oops, sorry about that. So what this study did, they x-rayed a bunch of individuals, and they found that some individuals presented with no pain and had these presentations of disc bulges or disc herniations, versus other people had these disc herniations and presented with pain. So meaning that not everyone will experience pain if they have this type of tissue damage or abnormal disc bulging. So a little bit about acute and chronic pain. So acute pain is defined by having pain usually less than 3 months. It typically occurs after an injury. So if you were to fall, scrape yourself, then you experience that instant pain. And it is also usually accompanied by inflammation, so swelling in your joints, or sometimes you may have skin color changes. It could be red, or it could be even blue and discoloration from a fall. And then if we look at chronic pain or persistent pain, this usually lasts for a time period greater than 3 months. Acute pain can also translate to chronic pain if not treated properly. And it is often not due to a specific injury, so may come about. And one thing I wanted to highlight with chronic pain, as it is associated often with sensitization. So sensitization means a lowering of pain threshold that increases the pain experience. So what that means, I'm just gonna give you an analogy of a fire alarm. So for example, in your home, many people have fire alarm or fire detectors. And what that is, if you have a big cloud of smoke or something is burning, then the fire alarm will go off. But with sensitization, let's say that fire alarm keeps going off. So then suddenly only a little flame, for example, from a candle, will set off that fire alarm. So things that in the past were not threatening, just a little candle, can cause that fire alarm to go off, so can cause that pain to come about. So if we look back, or if we take it back to our bodies, those simple movements that in the past weren't painful, for example, just bending down or tying your shoe, may cause you more discomfort and more pain. So Merrill will talk a little bit about later on about how we can modify that pain threshold and try to bring it back up a little bit so those movements won't be as painful anymore. So just a little bit more about pain. So like I mentioned, it's not always due to tissue damage. There are other components that are part of pain. So if you look at this little graph, usually you have tissue, sometimes you have damage or other triggers that can happen. And then that sends out a signal to your brain. And there are different components that play into it before sending out an output. So there are your thoughts, emotions, as well as your stressors. And then your brain decides to make a decision. So that can be either pain, it can be, for example, that situation with the bear at the beginning. So it can be to run away, more as a survival mechanism. Your brain may also decide to release some hormones to help you with that. So there could be different inputs on that. So I'm just going to take another example to try to illustrate that. So factors that can contribute to your pain. So like I mentioned, stressors, emotions, perceptions, and habits. So our goal will be to either try to self-manage these and make the box a little bit bigger so it has more room for all of these. Or the goal would be to take some of these factors away. So take away stress, take away emotions, and then your pain might be a little bit less. And then there are 4 kind of general treatments for pain. So for me, what stands out is your beliefs, lifestyle, coping strategies, and emotional and psychological factors. So many people, when they are in pain, they believe that movement is bad for them, and they think that they should just rest. But however, research has shown that movement is good. It's important to find the most appropriate type of movement and frequency. So not doing too much and slowly progressing. Lifestyle is also important. So sleep, diet, and exercise, like I just mentioned. So just to be mindful of your habits. Merrill and I have also created some resources about sleep hygiene that we could send out to you. So these are some sleep tips that will allow you to maybe have a better sleep and thus indirectly help with your pain. Some coping strategies is to focus on small gains, start small and progress slowly, and as well as emotional and psychological factors. So it's important to have a good support team, have some friends, family that you share it with, and it's also okay to seek help from others, such as professionals like psychologists or rehab professionals, to help you with that if you are going through some pain.
I'm going to carry on the discussion and talk more about the role of physiotherapy in dealing with chronic pain. So the first thing that a physiotherapist can help you with is just the role of understanding your pain. We receive a lot of education throughout our schooling on how to help people manage this condition. So we can talk to you about similar things that Katerina talked about. So what is pain? Why is it happening to you? What factors contribute to the experience of pain and how you can cope with it. So if you have any more questions about that, I'd recommend reaching out to a physiotherapist. I think that'd be a great place to start. The second thing that we can do is provide you with a graded exercise program to help you move your pain threshold. So next slide, please. Next slide, Katerina. Oh, okay, thank you. So like Katerina explained, the next slide. I can't hear you because you're muted. Okay, great. So so like Katerina explained, she explained the concept of sensitization of the nervous system to the signals from the environment that would normally not pose a threat to your body. It's very similar to the alarm system analogy, where the alarm becomes more sensitive to stimuli that wouldn't cause a threat to the house. So in the body, this means that input from the environment that would normally not cause your brain to be alarmed now triggers your brain to think that it's in danger, and it sends out an alarm signal. So physiotherapists can begin an exercise program with you that will gradually decrease your brain sensitization to the levels of stimulus that cause you pain. If we look at the diagram on the left, the blue column, we can think of the blue column as representing different levels of stimuli from the environment. So at the bottom of the blue column, we have things that would be very non-threatening, maybe picking up a cup, bending over to pick something up. And then at the top, we'd have things that would probably cause you harm, like doing a backflip or jumping off a building or something like that. And then we have 3 red lines. The first one at the bottom is the onset of pain. So that's your pain threshold. We have a flare-up line, and then at the very top, we have tissue tolerance or tissue damage. So that's the actual amount of stimulus that would need to happen to your body for you to, for example, break a bone or something like that. So what happens in chronic pain in someone who is sensitized is the bottom line for pain onset is lower than it would be in someone who doesn't have chronic pain with sensitization. And when we get a lower threshold for pain, we get an increased distance between tissue tolerance and onset of pain. So by introducing exercise that is at an appropriate intensity level, you can slowly start desensitizing your nervous system and your brain, and you can move that pain threshold onset higher up to where it would be in someone who doesn't have sensitization. And the way that we do that is by introducing exercise that allows you to work slightly past the onset of pain. So you do have to work into your pain, but you're not working into it for a long period of time, and you're not doing things that are really intense, because then you're going to get a flare up and it won't have the desired effect. But if you do it properly with guidance from a professional, you can slowly move that line back up. So a few tips with this would be to start with low intensity exercises, build up gradually to higher intensity exercises and longer durations, but you're starting off small to begin. You do small amounts often rather than large volumes less frequently, because that's a good way to get a flare up. You avoid prolonged activity and prolonged rest, and you don't rush the increases in activity. Okay, so the next thing that we can talk about is the idea of self-management. It's another thing that a physiotherapist can help you with. So self-management is really your ability to use the knowledge and the resources that you have to manage your chronic disease and your symptoms and the progression of that disease. So the 4 kind of key pillars to self-management are your physical health, your mental health, symptom management, and also your ability to communicate with your healthcare provider so you get yourself extra help when you need it. So I'm going to focus specifically on physical health and symptom management, and we're going to talk about arthritis, just because that was one of the most common conditions amongst the members of Oasis. So to start with, let's differentiate between the two types of arthritis. So we have the first one as osteoarthritis. So this is a degenerative joint disease that is characterized by, starts off with an increase in water content in the collagen that surrounds the long bones of your joint. And the increase in water content in that structure causes an increase in pressure in it. And then over time, we can get a loosening of the weave of fibers that make up that structure. And then when you continue to load it, it doesn't have to be intense loading. It can just be lifetime use of the joint. That's when we start to get degradation of the joint and we get osteoarthritis. So it commonly affects weight-bearing joints such as your knees and your hips, but it can also affect your hands and your back. And these are the most common symptoms. So we have stiffness, use-related pain, so pain typically when you're only loading that joint, a loss of the ability to move the joint throughout a normal, what we call a range of motion, instability of the joint, and sometimes joint deformity. So let's go over some different types of exercise that have proven benefits for individuals with osteoarthritis. So we can divide it into 3 types of exercise, the first being flexibility exercises. So this would include doing gentle stretching or just range of motion exercise, so moving your joint throughout the normal range of motion that you can. They should be pain-free and it should be unweighted, and you can do them daily. If you're doing stretches, we recommend doing them for about 60 seconds per muscle group. So whether that be your quads, your hamstrings, or your shoulders, 60 seconds per group. In terms of aerobic exercise, this is exercise that's going to get your heart rate up and your breathing rate up. So we're talking about walking, swimming, biking, dancing, tai chi, whatever you like to do that gets you up and moving. We want it done 3 to 5 days out of the week. And on the days that you choose to exercise, it's best if you can do it for 30 minutes total on that day, but it doesn't have to be continuous. It can be little bursts of 10 minutes, but just in the day, ideally we work up to 30 minutes. Should be moderate intensity. So what that means is you're working at a level where you start sweating a bit, your breathing rate increases, your heart rate increases, but you could probably still carry on a conversation with someone. You're not so winded that you can't talk, basically. And then we're talking about things that are low impact. So you're not jumping and doing running type exercises. You're doing things that offload the joint or maybe aren't weight bearing. So for example, swimming or biking would be good examples of low impact activity. And then the last one is strengthening exercises. So these ones are done 2 to 3 days out of the week. Again, major muscle groups. And for dosage, we say about 8 to 12 repetitions of the movement. So let's say it's bicep curls, you're doing 8 to 12. You take a little break and then you repeat that 1 to 4 times. And the note at the bottom about 1 repetition maximum just highlights the importance of staying between the 8 and 12. If you're working at 60% of your 1 rep maximum, it means that if you're able to do 15, then it's too easy and you need to add a little bit of weight in order to be in that 60% range. Conversely, if you can only do 4 or 6 of that exercise, it's too difficult and you need to take off some of the weight or modify it to make it easier. These are just the ideal ranges to get continued muscle growth or sustain the muscle strength that you have. So like I said, there's good news. Evidence does strongly suggest that people with osteoarthritis who exercise can decrease their pain, decrease stiffness, improve their mobility and function, improve their quality of life, and it has psychological benefits. So specifically the aerobic and strengthening exercises, they're particularly important to increasing strength of the muscles that surround your joint, and they can make your joint more stable. They can work to absorb the impact that would normally go through the joint, so you're decreasing the impact through the joint. And they can also provide good nutrition to the joint because we're increasing blood flow. Secondary impacts include maintaining a good healthy body weight, a good immune system, and then just maintaining your functional abilities as well. So the second type of arthritis that we can talk about is rheumatoid arthritis. So rheumatoid arthritis is a bit different in that it's caused by an overactivation of your immune system. So your body's immune system, which is normally there to protect you, can attack itself, and it attacks specifically the fluid that sits inside your joint, causes it to become very inflamed, and then that inflamed fluid can degrade the cartilage that's on the bones in that joint. And it's typically characterized by periods of flare-ups. So your joint becomes hot, red, irritated, swollen, followed by periods of remission. And that's what causes the joint destruction. So to manage an active flare, we can talk about these 4 things. Energy conservation. That would involve doing things to change your behavior in order to optimize your participation in activities that mean the most to you. So we can talk about the 3 Ps, so pacing yourself, spacing out your activities throughout the day so that you can take breaks and complete everything. Prioritizing, so prioritizing the activities that mean the most to you and doing those things first. And then also positioning, which brings me to my next point of splinting. So you can seek help from a physiotherapist who can make a splint for you. And typically the goal with the splint is to make the joint still so that you can't move it. And they splint it in a resting position to minimize the stress that's on the joint and thus like minimize the deformity that can happen after. For pain management, we can't really speak to any sort of drugs or anything like that. You'd have to talk to your pharmacist or doctor, but we can advise for heat and ice. So sometimes people use heat to calm their pain, but that is not advised for people with an active flare of rheumatoid arthritis. It can make the inflammation worse and lead to more joint destruction. You can, however, use ice. You can use it up to 72 hours after the acute flare starts, and mainly that just provides a numbing effect. Of course, if ice gives you any pain at all, then you're not to use any ice. In terms of exercise, intense exercise is not recommended during active flare-ups. In general, it's just pain-free, range of motion exercises, moving that joint throughout its pain-free range. And then you can do very light whole body exercises like walking or swimming. But a general rule for exercise is that if you have pain during the exercise in your joints that have arthritis, then you should modify it. We don't want you working into the pain with the arthritis. Also, if you end up having pain for more than an hour after you exercise, that's also a sign that it's not the right activity for you, and modifications should be made to the exercise that you're doing. Next slide. Okay, perfect. So during the periods of time where your joint isn't inflamed, research again shows that lifetime participation in low intensity exercise can promote positive outcomes in people with rheumatoid arthritis. But I just want to emphasize that exercise prescription is very individualized. It's based on the specific disease progression, your age, the status of your joints, whether or not they're deformed. We factor in things like fatigue, which can be very popular, or very common, not popular. So consulting with a professional is a good idea if you're gonna start exercising and you don't really know where to begin. But the best exercise is an exercise that you like doing. So if you're gonna go out into the community and seek out different programs, then I recommend maybe calling them and asking if they have experience working with people who have rheumatoid arthritis. Is there someone on the staff who can help me make modifications in the event that I can't do a specific exercise? And if there isn't, again, consulting a physiotherapist is a great place to start because we can give you tips on how to modify the exercises so they're safe for you. And then the other thing I'd like to mention is the use of assistive devices. So they can really help you maintain independence, reduce pain, reduce the stress on your joints, and help with fatigue so that you can continue participating in the activities you want to participate in. And physiotherapists can also help you give recommendations for devices, help you find different places to get them and fit them so they're the right size for you. And then the last thing I'd like to talk about is just a few tips about how to preserve your joints. So we call them joint protection principles. And that will ultimately just help prevent strain on your joints and muscles. So we have 5 here. The first one is avoid positions where your joints will be put into a deformed position. So for example, sometimes if you're trying to open a tightly sealed jar, your hand goes into this deformed position that might be painful because it's at the end range of the normal motion for the joint. So using things like jar openers can help you decrease the forces that you put through your hands. Maintaining good body position and postures by using proper moving and handling techniques. Keep the strength and flexibility of your muscles through regular physical activity like we described above. And when possible, try to distribute loads over larger surfaces of your body instead of concentrating a load into only 1 or 2 joints. So for example, if you're having trouble opening a door because you're just using a few joints in your hand, you could wrap a band around, maybe it's the fridge door, you could wrap a band around the fridge and instead use the momentum of your body, your shoulder, your elbow to open up the door. So it's just finding different modifications like that. And then lastly, when completing tasks, try to do so with your joint in the most stable position possible. And if you have any questions about these points or for more information, feel free to reach out to either one of us or you can consult a physiotherapist in your area.
Mm-hmm. So just as a summary, at the beginning I asked you a little bit about what do you feel when you're in pain? So some of them may have been frustrated, angry, feeling a bit being secluded, sense of not being yourself. And we hope that by the end of this presentation, you feel a bit more in control, have a bit more awareness, willing to change some of your behavior or habits, and understand that you're not alone in this, that you have support, and that you may refer to physiotherapists or other healthcare professionals to help you deal with this. So thank you very much, and we're here to answer some of your questions that you may have. So I'm just gonna go ahead and I will stop the recording.